Today we're going to be treating Nadia's lower back. So to treat her lower back, we'll use tools like soft tissue work, adjustments, a bit of percussive tools, the thumper, and the IFC. So Nadia, we're going to start off by warming up the lower back here, so loosening up the lower back. This tool here is called the thumper. So we're just going to place it along Nadia's paraspinal muscles. What you're doing is we're just increasing blood flow to the lower back here. This gives patients a bit of relief, helps with decreasing tone with tight muscles, right before treatment to loosen up muscles. All right, Nadia, let's get you to sit on up, face the wall to your right. Next, we're going to work on mobilizing the spine. To mobilize the spine, we're going to gently move the spine close to its end range just to get a bit of movement here. So this is really good for people with acute low back pain, because in most cases, when there's pain, we don't want to move our bodies, but moving our bodies is essential with recovery. What we're doing is we're gently getting some movement right here through the lumbar spine, a little bit right here up into the thoracolumbar region. So we're going to get a bit of rotation, so we're going to go down to the right, just challenging your joints here. On the other side, by mobilizing the back, we're telling the back that it's okay to start moving again. In most cases, early intervention of movement is very, very helpful for people with lower back pain. The longer you wait, the longer that back pain, there it is, lasts. So we want to try to get blood flowing to the muscles, the joints as early as possible, because with no movement, there isn't any blood flow. Now we're going to work on adjusting the spines. So for the adjustment here, we're going to set up Nadia. Nadia, we're going to adjust your lower back, okay? So for an adjustment, this is where we're going to do high velocity low amplitude thrusts. All we're looking for is a release through the joint. So we're in this region here. I'm just going to thrust this way, okay? Ready, breathe in, exhale. There we go. All right, Nadia, other side. Good, so we can feel that this joint is stiff, so we're going to adjust segment here. So you can breathe in, Nadia. Exhale, you're going to relax. Nice. Good, let's get you to sit on up. So let's take a look at your rotation. Really good. So you're getting good rotation there both ways. It's an easy test to see if we're on the verge of having lower back pain, because when you start to lose rotation, that's when we start to lose function and what our bodies can naturally do. And that could also lead to pain. So Nadia, we're going to finish off with the IFC machine. So what I'm going to get you to do is I'm going to get you lay down on your stomach. So the IFC machine uses interferential currents. What we're doing is we're placing the pads on the lumbar spine here, right beside, so right here on the paraspinal muscles, right beside the lumbar spine. So what this is going to do is you're going to send a current into the lower back, and you're going to see light vibration. Yeah, so what Nadia's feeling is a bit of light vibration. The current's going into the muscle, causing muscles to contract and to relax. Again, all we're doing is facilitating movement to get Nadia out of pain a lot quicker.